As patients, carers, members of the Philippine Alliance of Patient Organizations, we breathe disease and death every day.
It is a struggle on all fronts, physically, mentally, emotionally, spiritually, and financially.
It has its disappointments, but also high points, as we encountered kind, healing souls along the way. But just when we thought we had it tough, COVID-19 made our fears bigger and deeper.
We cannot afford another disease, nor can we afford to put up a fight on all fronts. This is not our fear alone. Never in the history of mankind that there has been a disease that destroyed and disrupted so many lives and hope all over the world.
The COVID-19 vaccine is offering us hope. It is not perfect, but at this moment, it is our best chance to stop living in fear and to start living in hope.
This will not work if only a few of us chose to be vaccinated. All of us need to get the vaccine because no one is safe until everyone is safe.
PAPO stands solidly with experts and advocates for COVID-19 vaccine. We invite you to join this call of unity as we launch Bakuna Now Na to address the infodemic and help increase vaccine acceptance.
Never in our history has there been a more urgent call to stand united, get vaccinated, so together we can overcome COVID-19.
Bakuna, now na! Bakuna, now na!
Bakuna, now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna Now Na!
Bakuna! Now na!
Bakuna, now na! Huwag ka na munang lumabas ng inyong bahay, maliban na lang kung bibili ng pagkain o may emergency. Tandaan ang mga sumusunod. Kung kailangang lumabas ng bahay, magsuot ng mask. Siguruhing may 1 metro ang layo sa ibang tao. Magdala lagi ng alcohol o alcohol-based hand sanitizer. Huwag hawakan ang iyong mukha. Sa wastong pag-iingat, ang virus hindi kakalat. COVID-19, kayang-kaya nating tapusin. Kaibigan, alam mo na ba kung ano ang mga karaniwang sintomas ng COVID-19? Ito ay ang mga sumusunod: lagnat, pagkapagod, at dry cough. Habang sa ilan naman ay sipon at baradong ilong, sore throat o diarrhea. May ilan naman na wala pang sintomas, pero pwede pa rin nilang maipasa ang virus sa iba. Kung ikaw ay nasa mga lugar kung saan kumakalat ang COVID-19 o kaya may close contact sa mga taong kumpirmadong may COVID-19 o sa mga nag-aalaga sa kanila, ipagbigay alam ito sa health workers sa inyong barangay. COVID-19, kayang-kaya nating tapusin. Nasistress ka na ba? Nagpapanik o natatakot dahil sa COVID-19? Normal lang ang ganitong mga reaksyon sa ngayon. Pero may magagawa ka para mapagtagumpayan ang sitwasyon na ito. Ituloy lang ang pangangamusta sa mga kamag-anak at kaibigan gamit ang text, tawag o video. Tiyakin na ang mga bata ay ligtas at nasa maayos na kalagayan. Gawin sa bahay ang mga nakasanayan upang hindi mabagot o mabalisa sa panahong ito. Sa wastong pag-iingat, ang virus hindi kakalat. COVID-19, kayang-kaya nating tapusin. Labanan ng COVID-19, ang kailangan natin ay tama at totoong impormasyon, hindi fake news. Huwag ka agad maniniwala sa nababasa at naririnig. Ang pagkalat ng mga maling paniniwala tungkol sa COVID-19 ay nagdudulot ng panik, takot at maling desisyon. Laging i-double check kung saan nanggaling ang nabasa o narinig. Maging mapanuri at i-share lamang ang tamang impormasyon. Sa wastong pag-iingat, ang virus hindi kakalat. COVID-19, kayang-kaya nating tapusin.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solusyon.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Kumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA. Be the solusyon sa COVID-19.
Hi everyone, I'm Meryl Jalani, one of the trustees of the Policy Center. Our organization works to support the attainment of the Sustainable Development Goals 2030. One of the agenda of the organization is to make sure that every child is safe, not only at home, but also in school and on the road. The COVID-19 pandemic brought us many uncertainties, not only with us adults, but most especially our children, the most vulnerable group during these times. The National Safe Kids Week will be celebrated this coming 3rd week of June by the virtue of the Presidential Proclamation 1307 in 2007. Of course, it was signed in 2007 by Gloria Macapagal Arroyo. This year, may we invite everyone to continually working to make every child safe, not only in school, but also at home and later on the road. Let us make sure that our children are safer, not only today, but most especially tomorrow. Thank you.
Hello, good evening everyone. Welcome again to another episode of Alaga Health Live. And I am your host, Dr. Dexter Galban. Thank you for joining us. And today it's very, very special because we are celebrating a very important milestone. That one is particularly National Safe Kids Week. And today we're very fortunate to be joined by so many amazing guests, as well as medical professionals and health professionals who are here to help share how we can better take care of our kids and how we can better take care of everyone else. So without further ado, I would love to introduce all of them to you. So let's go down the roll. So first up, our resident psychiatrist, Alaga Health's resident psychiatrist, give it up for the one and only Dr. Joan Rifareal. Hi, Doc Joan. Good evening po. Welcome back to Alaga Health Live.
Thank you very much for having me once again. Good evening, Dr. Dex, at sa lahat po ng nakikinig tonight. Happy National Safe Kids Week.
Perfect. Thank you very much, Doc Joan. And of course, our discussion will not be complete without our resident pediatrician. And that one is someone whom I have had the pleasure of learning from, and working with. And she is none other than Dr. Annie Carpio. Hi, Doc Annie.
Hello, Doc Dex. Hello, good evening, everybody. Happy National Safe Kids Week.
All right. Thank you, Doc Annie. So we go way back. Hi, Doc Annie. Welcome to the show. And of course, joining us would be none other than Alaga Health's resident primary care physician, and that would be none other than Dr. Via Roderos. Hi, Doc Via. Okay, looks like nakamute si Doc Via. Hopefully we could hear you better. Probably just some technical concerns. Hi, Doc Via. Okay, so we have our health professionals already in the room. Perhaps we can now jump into our special guests. And of course, we would like to introduce them to you one by one. First up, back from last week's record-breaking episode, she is back with another part of our advocacy from Kythe Foundation, as well as the Philippine Alliance of Patient Organizations. I would love to introduce to you all once again, Ma'am Girly Lorenzo. Hi, Ma'am Girly. Kamusta po? Good evening.
Hi, Dex. Can you hear me? Okay?
Yes.
Hi. Thank you for having me again. Hi, everyone.
It's a pleasure, Ma'am Girly, no? And of course, we now would have to talk about the young people. How best can we talk about young people? Probably the best way would be to bring in more young people. So, representing Millennials PH. Yes, this is a national organization of millennials. Some probably ending their term as young people, while for some, probably already turning in a new leaf and being young parents themselves. So probably they want to find out how to best take care of their kids. So that would be none other than Miss Meryl Jalani. Hello, Meryl. Okay, it looks like she's having a little bit of difficulty joining us, maybe because of the technical problems. No, weather is a major issue right now. So maybe we can jump to our last guest, perhaps for this evening. We have last two guests. One would be, she is part of the Bloomberg Initiative for Road Safety. Let's give it up for Ma'am Kythe Villena. Hi, Ma'am Kythe. She's also part of the Policy Center. Hi, Ma'am Kythe.
Hi, Dex. Hi, everyone. Good evening to everyone and to all those who are watching right now. Good evening.
Yes. Hi, Ma'am Kythe. Thank you po for joining us. And last but definitely not the least, no, this person is very close to my heart because I work with her in the Commission on Population and Development, or POPCOM, and she is the AD of IMCD of our lovely government agency. Let's give it up for the lovely, the beautiful Ma'am Mai Quiray. Hi, Ma'am. Good evening po.
Good evening, Doc Dex, at magsayang pamilya po sa ating lahat. Magandang gabi po.
All right, perfect. So we have the full team ready. Let's get it on. Perhaps we can start this up with just another check-up right here, right now. So let's play that video. Time for another checkup. Thanks, everyone.
Hi everyone, I'm Meryl Jalani, one of the trustees of the Policy Center. Our organization works to support the attainment of the Sustainable Development Goals 2030. One of the agenda of the organization is to make sure that every child is safe, not only at home, but also in school and on the road. The COVID-19 pandemic brought us many uncertainties not only with us adults, but most especially our children, the most vulnerable group during these times. The National Safe Kids Week will be celebrated this coming third week of June by the virtue of the Presidential Proclamation 1307 in 2007. Of course, it was signed in 2007 by Gloria Macapagal Arroyo. This year, may we invite everyone to continually working to make every child safe, not only in school, but also at home and later on the road. Let us make sure that our children are safer, not only today, but most especially tomorrow. Thank you.
All right, so that was a message from our dear partners who have already shared with us why we're celebrating this wonderful event here today. So, it's actually originally supposed to just talk about trauma or avoiding traumatic events for children, but we decided to expand it to talk about the safety of children or kids as a whole. So, perhaps we can jump right into it, no? Let's ask our resident health professionals. Probably we can have very quick opening tips regarding your area of expertise, maybe mental health, pediatrics, or maybe even primary care. Any quick thoughts po on how to best take care of their kids? Doc Joan and Doc Annie, any thoughts po?
Yeah, good evening again. Good evening to everyone. Quick thoughts lang, Dr. Dex, really, na, to keep a safe space talaga, no, sa bahay. It starts from the earliest possible, no, right after, immediately after delivery of a baby. Talagang we create that safe space for our kids. Of course, parenting is also very important kasi hindi lang siya about the baby, but of course, the parents are very crucial. Sobrang crucial po ng roles ng parents and parenting because we know na it's always an interplay of all of these factors in the development of our kids, especially in promoting their safety in the homes. Kasi doon talaga nagsisimula before they branch out or they go out of their homes to go to school, etc. So, yeah, those are my paunang mga words. So, it really starts with a good parenting. So, parents po, kung may mga nakikinig tonight, your roles are really very important. And self-awareness is the key, no, for our parents and for everyone in the home.
All right. So sabi ni Doc Joan, it starts from the time that they were brought into this world, diba? And it doesn't really stop there. So this episode is really dedicated to kids. So please tell us in the comment section if you have any questions for our lovely guests tonight. And of course, let's add to that a little bit more. Maybe Doc Annie has some number one level tips for everyone else. So any thoughts, Doc Annie, for our parents to better take care of the kids?
So I agree with Dr. Joanne, no? So pagkalabas ng baby, important na to make sure ang safety ng baby. So ang pinaka may primary role is the parents and especially the family, yung mga siblings and then also yung mga relatives, no? Sa school, important din ang role ng mga teachers, classmates, also yung mga kasama sa safety ng kids, no? So in the home, no, important to prevent danger or kids safe, no? Important yung mga dangerous items keep the high level na hindi reach ng bata, no? Nakagay ng maayos sa mga bagay-bagay. Saka mabantay mabuti ang mga bata. Sa school, importante ang edukasyon ng mga guro, no? And then, sa paglaki, yung mga kaibigan din ay silbing role sa safety ng mga bata.
All right. Thank you for that, Doc Annie. You know, so maybe people are wondering here, what our other special guests are advocating about? Why are they here in this conversation? So before we get to that, very quick words from Doc Via Roderos. Hi, Doc Via. Any initial thoughts about how to take care of our kids?
Hi again. Good evening everyone and magandang gabi po sa lahat ng nanonood po ng Alaga Health Live. Nandito na naman po tayo sa isang very interesting episode about children. I'm sure marami namang matututunan yung ating mga viewers and especially the mommies who are actually watching us live from FB and from StreamYard and Quarant Talk Media. No? So what I can share regarding child safety and promoting the health of our children is, of course, prevention is always the key. No? Not only in terms of how we take care of our kids, how we keep them safe, but also how we keep them away from diseases. No? So important is most especially that we emphasize to our parents that prevention of diseases is always best, no, in terms of taking care of our kids, especially looking at interventions for prevention such as vaccinations, no. So important po yun. Important pong prevention in terms of making our kids safe and healthy. So I hope we will be able to have a very fruitful discussion, no? And I'm sure marami pong mapapag-usapan ngayong gabi at dahil ang pag-uusapan po natin ngayon ay tungkol sa mga bata. So I'm looking forward to it, Doc Dex. Hello po to our guest speakers. We are very happy to have you with us.
Perfect. Doc Via, you mentioned the keyword of tonight, prevention. Nako. And nandito yung mga guests natin, mga champions of prevention of any form of harm to our kids. So isa-isahin natin sa kanila, sila, no? So umpisahan na natin sa may pinakamalapit talaga sa original definition ng Safe Kids Week. Ito yung prevention of trauma. So maybe we can ask Ma'am Joffy Villena, ano po ba ang ating advocacy at ano po ba yung reminders natin sa ating mga parents o sa mga nanonood po sa atin on how to best take care of their kids? Yan, from the Bloomberg Initiative. Si Ma'am nakaano pa.
Yes, yan.
Yeah,
okay, good evening again to everyone. So, yung aming advocacy really is road safety for children. We've been doing this for, siguro I've been involved with it since 2017. Ang ginagawa namin is that we give tips or educate our parents, our teachers on how best to take care of our children while they're on the roads and in moving vehicles. Yung current na pinasa na law last February 2019 pa yun actually, August 2019, yung ating RA 11229 which is the Child Safety in Motor Vehicles. Medyo naging controversial lang itong isang law na ito which promotes child safety because of the use kasi ng child car seats. But the law is more than just child car seats in private vehicles. It also talks about why is it important for your children not to be nandun sa harap ng sasakyan. So, the law states kasi ngayon na mas pinalawig pa yung edad na hindi pwedeng umupo ang mga bata sa harap ng sasakyan, specifically to sa mga private vehicle. And even, I'm sure it's also in the public vehicles natin, ano? So, meron na tayong bagong batas ngayon. So, it's not just about car seats. So ito yung ilan sa mga binibigay namin pag-aaral or tinuturo din natin sa mga magulang or sa public kung paano alagaan natin mga children. Isa pa is yung ensuring that the periphery of our school is very safe for children. Especially yung mga, kahit hindi mga nakasakay sa sasakyan ng mga bata kasi ang mga bata walang sense of lugar yan. Basta sa kanila playground. Paglabas nila, playground na yan. So, dapat ang ating mga kabataan or mga children natin is one of the vulnerable road users kasi. So, we wanted sana our roads to be pedestrian-friendly, especially for children. So, isa yan sa mga tinututukan din ng ating advocacy. How to make school safe school zone. Yan. Yon.
Yan. Thank you very much, Ma'am Jofty, no? So giving us an idea that taking care of kids does not have to just end within the center of the home or even in school, even on the road. Very important talaga yan, ma'am, no? So, tala naman tayo kay Ma'am Girly Lorenzo. So, of course, she was here last week representing Kythe and Papo. This time, of course, you want to highlight naman specifically for kids, particularly even cancer, those kids with cancer. So any thoughts, Ma'am Girly, how we can best protect our kids more so that if they're already sick or they're already in the hospital? Any thoughts po, Ma'am Girly?
Oo. So, thank you, Dex, no? So, ang advocacy ng Kythe ay kami ay nag-i-implement na tinatawag namin yung Child Life Services. Yung Child Life Services sa hospital, ang ginagawa namin doon ay we educate and we prepare the children and the parents about the illness. Kasi minsan, 'di ba, doon pumapasok yung yung safety eh. Kasi kailangan alam nila kung ano yung sakit nila, ano yung procedure, so that they will be responsible also. Meron rin silang part, 'di ba, sa treatment. Yon. And we also advocate na alam mo yung medicines, 'di ba? Minsan hindi naman natin gusto pero nagkakamali din minsan ang ating mga medical staff, 'di po ba? So ine-encourage po namin nagsulat nila sa journal. Ano ba yung medicine nila? Ilang beses ba kailangan kunin? Kung ano yung brand ng kanilang medicine, ganyan. Kasi partnership to, 'di ba, with the medical team na parang ma'am, 'di ba, ang ang reseta ni doktor, 'di ba, ganito. So nire-remind din, 'di ba? Kasi kailangan they are also responsible. Tsaka yung tawag nating patient safety, 'di ba? Alam mo yung release nung sa bed, 'di ba? Ano tawag ng bed railings, 'di ba? So we always educate the parents na kailangan nakataas 'yon. Di ba yung ganon? So, patient safety in the hospital is a two-way process. Hindi lang po sa medical staff, pati din po sa pamilya at sa mga bata. Yun po. Over
ang
to you.
ganda naman ito. Thank you, Ma'am Girl. Ang ganda nito kasi we are talking about taking care of kids at home, in school, on the road. Ngayon, even in the hospital, meron pa pala tayong additional level of discussion pagdating sa taking care of kids in the hospital level or if they're in the hospital. So, talo naman tayo sa ating isa pang special guest this evening. And she is none other than Ma'am Mai. Kamusta po? Let's talk about Popcom's major advocacies or prime advocacies when it comes to talking about teen pregnancies. Ako, malaking issue po yan ngayon, especially with the number of cases going up. Any thoughts, Ma'am Mai?
Yes. So, again po, masayang pamilya sa ating lahat at magandang gabi, Commissioner Dex and the lovely ladies in yellow and white tonight. So, for us, for Popcom, our commissioner is really one of the most active talaga working for our advocacy. So, alam po natin, no, you are talking about parents, no? They are the primary educator talaga dapat on sexuality naman for our kids. No, we know that the young adult fertility and sexuality study has shown that only 10% of Filipino parents communicate about sexuality with their children. So it's a sad fact, no? That's why the Commission Population and Development, yan po talaga yung advocacy natin. Gusto natin yung ating mga parents, sila yung maging primary educator about sexuality para ang ating mga kabataang Filipino ay hindi mabuntis ng maaga at hindi pumasok sa mga, we are talking about risks here tonight, no? Na hindi sila pumasok sa mga early sexual and non-sexual risk behavior. So, yung po talaga yung advocacy yan working with the parents on communicating about sexuality so that yung ating teen pregnancy, no, na 171 every day ng minors na mga Pilipino ay nabubuntis. Mga kabataang Pilipina na edad 10 hanggang 19 ay nabubuntis every day. Nung 2019, what more pag nilabas na yung data sa pandemic ng 2020? No, we know that service reductions and the pandemic Ayon sa pag-aaral ng United Nations Population Fund and University of the Philippines Population Institute, talaga pong mas madami pa po ang ini-expect nating teen pregnancy. So napakahalaga po ng advokasya ninyo, Commissioner Dex, at ating mga kasama dito talking about safety of all aspects of our Filipino children. So with that po, yun po talaga yung advokasya ng POPCOM, working with parents, with the schools on comprehensive sexuality education, and of course our young people of today. We want them to be responsible citizens, to exhibit responsible sexual behavior. So ayun po, marami pong salamat sa pag-invite sa POPCOM.
Thank you, Ma'am Mai, no? So, thank you for sharing what we do in POPCOM. And of course, nakikita natin ang maraming areas. So, iisipin pa ng mga magulang, nako, are my kids not safe? Do we really need to take care of them in so many different places? What more now kapag may pandemic? I see here a question. Okay, from one of our partner pages, no? Ang question niya, tago natin siya sa pangalang Mark. Nakakaramdam po ako ng sobrang stress ngayong pandemic. Paano po ba mag-cope? Kasi po, wala na po yung mga usual na ginagawa naming mga magkakabarkada. Mukhang mental health to. Of course, I think we're seeing a trend, no? Mental health is automatically a major concern during this pandemic and they feel unsafe. Wala na yung kanilang mga tinatawag na support systems or at least na iba. Any thoughts on that, Doc Joan? Because now people feel that they're unsafe or wala silang output, wala silang matatakbuhan whenever they feel stressed. Any thoughts po, Doc Joan?
Yes, oo. Thank you very much, Mark, sa yung question, which is really very relevant, especially sa mga sa age group ninyo, no? Na talagang, I think, no, kasi nga, it's sa age group, parang I think napipicture ko na kayo yung magkakabarkada, siguro mga teens sila, no, na may barkadahan, samahan sa school, and definitely understandable yun, no, na mamimiss niyo ang isa't isa. Hindi niyo makikita yung mga crushes sa school kasi nga wala tayong ngayon, no, walang pasok. I mean, walang physical na classes. So, but at itong physical distancing, which is one of the minimum health protocols natin ngayon, it doesn't mean na hindi tayo pwedeng maging socially connected. So please maintain social connectedness. Pwede kayo mag-catch up virtually, yung mga barkada, na yung mga friends. May mga platforms ngayon na pwede kayong sabay-sabay mag-chat or mag-video call or manonood ng movie together. So alam ko may mga ganun na mga apps ngayon. And of course, drop a line or two. Always make sure na magkamustahan kasi we know na pag ang isang individual ay isolated, especially sa age group ninyo, tumataas ang risk, no, para maramdaman ang loneliness, and this may lead to symptoms or feelings of lungkot, anxiety. Kaya tama yung question mo, Mark, no, na ano ang pwedeng gawin because of the stress levels. And definitely, maraming pwedeng gawin. Like yun, no, catch up virtually or maging creative, gawa ng mga bagay na parang it can be a form of a stress outlet for you habang nasa bahay. Do the things which make you feel good and happy kasi para tumaas ang happy hormone. So, halimbawa, yung iba nagpa-plants or siguro sa iyo, Mark, no, yung exercise, hindi yung mga gym levels na exercise kasi bawal pa mag-gym, but yung sa bahay, no, lakad-lakad or simple exercises, stretching, and siguro do things also with your family, like watch mga comedy shows. Kasi yun, pag tumatawa tayo, nakakataas din yun ng endorphins, nakakataas ng happy hormones. So, yan, maraming pwedeng gawin, in fact, no? So, yeah, yun yung mga maipapayo ko, Mark. So, still, catch up virtually pa rin. And physical distancing does not mean no, we cannot remain socially connected with our friends and barkadas.
Okay, perfect. Thank you for that, Doc Jono. Very timely, especially during this pandemic. And ito, meron tayo mga questions ulit. Ito naman, sabi niya, Doc, tago natin siya sa pangalan na Gedita. Yeah, Gedita. Sana daw ay makakonect daw siya dahil gusto daw niyang itanong yung anak daw niya, 10 years old pa lang, pero para daw siyang napapanot. Ano daw po ba ang dapat gawin? Ako, perfect na perfect kasi nandito ang ating very, very reliable, no? And wonderful pediatrician, Doc Annie. Ano po ba masasabi natin? Mag-worry po ba dapat? 10 years old pa lang, naku, napapanot na pa ata. Ano po ba ang response natin dito? Ano pong dapat gawin ni Mommy?
Maganda ito, ang panood sa bata, no, hindi siya common, no, usually sa matatanda, no. Magandang obserbahan, so maliban sa pagpapanood, meron bang mga rashes o ibang sintomas, no. Most common kasi pwedeng fungal infection or yung genetics or autoimmune, no. Usually, nagre-resolve naman ng agad din, no? Pero kung persistent or tuloy-tuloy, importante na magkonsulta sa doktor, pediatrician, or sa derma.
Okay. Thank you for that, Doc Annie. So, I think we have one more question here. Okay. Ito. Ang aking, taga rin siya sa pangalang Lola, kasi apo daw Lola Maria Teresa. Para po sa aking apo, na pag ang gusto daw niya ay para daw po tumaba at lumakas ang kanyang resistensya. 12-year-old girl daw ang kanyang apo. Ano daw po ba ang magandang gawin? So I assume si ate, so yung ating batang tinutukoy dito, hindi masyadong masigla o puno ng resistensya. Any thoughts naman tayo dyan, Doc Via? Anong pwede natin gano'n? Or even Doc Annie, no? Any thoughts kung paano natin mas pasisiglahin yung ating mga kabataan, especially within that age group, very picky o kaya walang ginawa kundi ang focus lang ay yung mga usual food na in-order online. Any thoughts, Doc Via and Doc Annie?
Alright. I'll probably go first before si Doc Annie, no? Naku, tama ka dyan, Doc Dex, no? I understand yung sa viewer natin, 12-year-old po yung kanyang apo, no? Usually at that age, nagiging picky talaga yung mga kabataan natin or your kids will be very picky about what they eat because during that time, mga adolescent period, yan yung time na medyo nagsistart na maging conscious yung mga bata regarding their physical appearance, especially with how much they weigh, no? Yung mga ayaw nilang mabully sa school because of their weight, no? So they become very conscious about what they eat, no? Masyado sila or medyong nag-air sila on the side of being picky regarding ano bang pwedeng nilang kainin, ano bang pwede nilang kainin that can make them go or that can make them lose weight, no? So those are the things that we have to remember, no? And one of the things also that can affect actually or makakaapekto doon sa kalusugan at sa nutrisyon ng ating mga kabataan is the availability of the food that we have in our homes, no? Kasi meron pong mga pag-aaral na kapag ang available na food sa bahay natin ay mas kalimitan nito ay mas yung mga unhealthy na food, no, rich in saturated fat or yung mga junk food na tinatawag natin, yung mga kabataan natin are more likely to eat unhealthy food groups, no, pag ganun po. So what we can do with that is to always make healthy food available, no? Kahit po sa mesa natin, maglagay lang tayo ng fruits, maglagay lang tayo ng banana, ng apple, ng orange. That can actually do a lot, no, doon sa kalusugan ng ating mga kabataan or doon sa nutrisyon ng ating kabataan, no? Kasi wala silang ibang kakainin kundi yung available food lang sa bahay, no? So if we make healthy food available to them, that will most likely shift yung eating habits nila towards the healthier side, no? And one of the things also that we have to remember, kasi very picky yung, kaya nga na sinasabi ko, very picky yung mga adolescents natin with regards to food, no? And usually, they become so distracted with everything that has been happening in their daily activities. Minsan, nakakalimutan na nilang kumain. So, we can always set time, no? Sa pamilya natin, kung kailan ang oras ng pagkain, no? At this is an important factor also para mapanatili natin yung close connection natin, not only with our kids, but also with our other family members, no? Na kahit na work from home tayo, na kahit na nandito lang tayo sa bahay, ay mag-uusap-usap pa rin tayo about what happens during the day, no? Because that's important, not only in terms of building our relationship, but also in terms of keeping our family safe and healthy. So important po yun. Number one, make food or make healthy foods available in our table. And number two, always set time for meals po. Kasi important po yun in terms of building good or healthy eating habits. especially for adolescents.
All right. Thank you for that, Doc Via. Anything to add, Doc Annie?
So agree ako kay Doc Via, no? Important din ang role ng pamilya na maging good role model. So kung nakikita nilang healthy yung kinakain ng pamilya, so usually pina-follow din naman nila. Pangalawa, importante din yung exercise, no? Dapat at least may activity, no? 30 minutes to 60 minutes per day, and then enough sleep. Pansin ko sa age group nito, usually natutulog sila lang late or kulang. So important na natutulog time at kompleto kasi important din yon sa tamang kalusugan ng bata.
Perfect. Thank you for that, Doc Annie. No? And now I think we can go to our special guests. Let's open the gates and let them ask the common questions siguro in their line of work na gusto sana nilang i-raise o itanong sa ating mga resident medical experts from. We have psychiatry, we have pediatrics, we have primary care. Miss Mai, Ma'am Jofty, Ma'am Girly, any thoughts po or questions po na gusto niyong i-raise? Ano po ba yung mga common questions ng mga advocates or even mga patients na nakakausap po natin in our line of work? Probably kay Ma'am Mai, something to do with teenage pregnancy, kay Ma'am Jofty, road safety, and kay Ma'am Girly, how to best take care of patients who are already in the hospital. Ano po ba yung mga common questions or concerns sa area of advocacy ninyo? So, let's siguro ask Ma'am Girly muna. Hi, Ma'am Girly. Any thoughts po? Ano po ba yung mga common questions ng mga magulang o even patients?
Yes, thank you again, Dex. Ang common question ng mga magulang, syempre, alam mo, kasi cancer yung ano namin, di ba? Baka medyo bibigat yung ano natin, discussion natin ng konti. Kasi syempre, pag yung cancer, ang parating ano is, ang common ang perception nila is always ay gagaling ba ang anak ko or mamamatay ba ang anak ko? Yon, parating ganon. Parating parang nakakonect parate yung cancer sa kamatayan, yung death. So yun yung common na question. So, yun. So, I think we discussed this last week, pero siguro si Dr. Jo, meron pang uling pwedeng masabi, di ba, sa ating mga magulang about that. Yeah.
Ayun, Doc Joan, you have been requested by Ma'am Girly. Any thoughts po, Doc?
Yeah, oo. Talagang yes, I agree, Ma'am Girly, no? Napag-usapan natin to last week, but I would just like to reiterate na let us always acknowledge. Acknowledgement talaga, very important na we acknowledge kung ano man yung mga fear natin, ano yung mga takot, ano yung mga pangamba, worry natin about the cancer diagnosis. Mas maganda para maalay yung fear, of course, education, no? And awareness is very important. So, mas maganda makausap natin yung mga primary doctors ng ating mga anak, no? Na who are all, of course, taking good care na sa ating mga anak na may mga cancer po. And of course, wag pabayaan din po ang sarili, no, sa mga magulang. Kasi syempre mahirap, no? Mahirap ito na process always. And yung pinag-usapan din natin last week, no, na any form of loss po kasi, be it real loss or perceived loss, no? Yung parang perceived lang, no? Yung parang naiisip lang natin na may mangyayari, etc. Dumadaan talaga tayo po sa grieving process. So, let's go through the grieving process po. Tandaan natin na hindi po tayo nag-iisa. Get the support, no, from mga friends po ninyo, ibang members po ng family. No one should go through this alone po, especially yung mga magulang. Kung kaya po, no, let's ask for help para po sa pag-alaga, sa pag-take care. Kasi kailangan din po ng mga parents to also take good care of themselves kasi mas marami po, mas maalagaan nila ang kanilang mga anak or yung ang kanilang child, no, na dumadaan ng cancer kung sila din po ay also naalagaan ng kanilang sarili.
Perfect. Thank you for that, Doc John. Nako, tanungin natin ang ating other guests, no, from Popcom and from the Bloomberg Initiative. Nako, kasi may overlap yan mga concerns affecting probably teenage pregnancy or even road safety. Alam ko, recent issue yan just a couple of weeks ago, yung sa car seat. Take advantage na po natin. Nandito si Doc Annie, our resident pediatrician, and actually pediatric consultant. Yeah, very excited po tayo to ask her some of the questions. Ano po ba yung mga gusto niyo sanang itanong sa ating mga medical professionals pagdating sa advocacy on preventing teenage pregnancies as well as keeping kids safe on the road. Ito, unahin na natin si Ma'am Mai kasi by the way, tune in po tayo sa Usap Tayo sa Family Planning sa official Popcom Facebook page. Si Ma'am Mai po along with Doc GP ang ating hosts there. So, take it away, Ma'am Mai.
Yes, actually, alam naman natin ang common question po talaga whenever we have our advocacy ay ng mga parents ay paano ko ba sisimulan ang diskusyon tungkol sa sexuality sa aking anak? Anong edad ko dapat siya impusahan? No? So yun siguro yung gusto kong tanungin kay Doc Joan kasi 'di ba we all the beautiful doctor, no? Na-appreciate ko yung lahat ng mga good advice niyo po. Yung po talaga, Doc, parang ano po ba? What is the best and when is the best time to discuss and start discussions on sexuality?
Tandem, Doc Joan and Doc Annie. Perfect. Go, Doc Joan. Thank you po.
Ako muna? Yeah, Ma'am Mai,
Thank you po,
thank you for your question, Ma'am Mai. Really very relevant, na, especially ngayon. Talagang kasi maraming influences na no? Like for example, no, isa sa mga nasuri sa pag-aaral about yung maaga po, no, na pregnant is yung social media also, effect of social media and yung mga peer pressure, etc. So mas maganda po, no, the moment na they enter that period na sila po ay aware na of their body functions, no, ng kanilang katawan. Usually ito start na po, no, sa mga around age of mga 12, di ba po? Yung nagsa-start na, no, or earlier siguro for some of the females na mas maaga po, no, na nagkakaroon na ng changes sa kanilang pangangatawan due to the monthly po na mga changes in the hormones related to the monthly menstrual cycle. So as soon as aware na po ang mga bata about the changes sa kanilang katawan, mas maganda po to have that open space already, safe space already sa bahay, lalo na kung sa mga parents po na to be comfortable. Sometimes kasi ang mga parents din ay hindi comfortable to talk about it. Sila yung parang na-embarrass. So please, parents, always make sure na you are comfortable also to talk about it with your kids, lalo na pag curious po ang mga anak natin. Kasi may mga bata po kahit na as early as mga bata na, Ma, paano ba ako lumabas? Yung mga ganon. Paano? So pag ganon po, then let's let's explain it to them na in an age-appropriate po na manner na to correct also yung mga misperception or misconception about it. The earliest na nakakaintindi po sila.
Perfect.
Thank you.
Anything to add, Doc Annie? Yes. Anything to add, Doc Annie?
Hello. Sige. So at age 3 years old, alam na nila kung ano yung sexuality na boy or girl. At this age, pwede nang start paunti-unti, no? Currently, may mga libro, no, na parang nag-explain ng mga body parts ng babae at lalaki. Siguro pwedeng simulan muna na ganun para alam nila at maging aware about sa sarili na. Then habang lumalaki, especially sa adolescents, as po ni Dr. Joan, talaga i-emphasize ang importance ng sexuality. Pero for me, kahit siguro at the age of 3, kasi since at that age, alam na nila kung babae o lalaki sila. Ayan.
Very early on pala talaga. So, ma'am, may pag-uusapan tayo sa Popcom. Mukhang aagahan pala natin ang ating pag-prepare ng ating sexual health and reproductive health education. Gawing age-appropriate even that early. Well, recommended by Doc Annie. Nako, sige, talon tayo kay Ma'am Jofty. Ma'am, laging issue nila, car seat. Bakit pa natin kailangan yan to keep kids safe? May mga questions po ba na itinatanong ang ating mga parents pagdating sa advocacy natin? Maybe sina Doc Annie, sila Doc V, sila Doc Joan can give us a quick answer for those.
Okay, sige. Doc Annie and Doc Joan, no? Ang kalimitan kasi na nahirapan kami sa mga parents is yung sanay kasi magulang na kandungin yung mga anak sa sasakyan. So that's the culture kasi. So para sa kanila, safe na yung mga bata, basta kinakandong sila ng mga magulang nila. In fact, in one of our earlier advocacy sa pagpasa sa child car seats na to, kasama namin yung Philippine Pediatric Society, and I believe that they have an early advocacy parang mga videos for doctors and for parents on how to really make the children safe on the road. So yun yung pwede ko sana itanong kala Doc Annie and Doc Joan, kung paano ho kaya natin makakasipag kayo po ang nagpaliwanag sa magulang in one of the sessions or one of the consultation nila sa inyo, ay pwede nyo silang mapayuhan na hindi po sapat yung pagkandong sa mga bata pagdating po sa safety nila sa sasakyan. Kasi po, may science po yan. Alam natin, mabigat ang bata kapag nagkaroon ng impact sa road crash or nagkaroon ng banggaan. So, ang tendency talaga, mabibitawan yung bata. So, paano po kaya yun? Baka nung Philippine Pediatric Society, tinulungan nila kami dyan. Yung isa pa sana namin gusto na makasama yung mga OB-GYN kasi paglabas ng bata sa ospital, pagka panganak ng nanay, dapat sana naka-infant carrier na siya papunta sa Pero, syempre, hindi natin yan ma-force yung magulang. So, gusto ko marinig yung ating mga doktor, baka po pwedeng makatulong yung ating mga MDs and ating health professionals to help us with the advocacy and explain to the parents the reason why carrying them on the lap is not enough. Yun po.
Perfect. So maybe we can ask Doc Annie and Doc Via, primary care and ating resident pediatrician or resident pediatric consultant. Nako, very important issue yan. Very hot topic even in legislation right now. So, Doc Annie, Doc Via, any thoughts sa sinabi ni Ma'am Joffy?
Hi, Ma'am Joffy. So, agree nga din ako sa advocacies, Mahirap talagang i-convince, Lalo na yung mga dito sa Pilipinas. So, iba nga makita natin yung mga bata nasa motorsiklo, di ba? Tapos, what more pa yung lalagay nila sa car seat, Important talaga yung edukasyon, tsaka paglilinaw yung ng risk, tsaka benefit nung paglagay ng car seat, sa mga bata, Kasi, sobrang delikado din talaga kung walang car seat. So, important ang role ng parents at the same time ng mga doctors and mga teachers to educate yung family about it.
Perfect. Thank you, Doc Annie. Nako, since ang nakakaharap kalimitan ng mga magulang, primary care doctor or general physician, nako, it would be good to ask our primary care expert dito, Doc Via. Lalo na you're entering in the delving in the area of public policy or health policy. Ano ang masasabi mo dito? Ano ang masasabi mo kay Ma'am Joffy?
Alright, thank you for that question, Ma'am Joffy. And tama yung sinabi ni Doc Annie, regarding the role of parents in terms of pag-explain, at pag-iintindi kung bakit ba natin ginagawa nito. Balik tayo sa sinabi ko kanina nung umpisa ng show natin, The key to a healthier child or to the health and safety of our children is really prevention. I-explain yung key for us to be able to push for having safer environment for our children is to highlight to them the importance of why we're doing it, which is we are preventing them from being harmed because of the externalities that we have dito sa environment natin, Kasi we really never know what will happen. We want to keep as much as possible, keep our kids safe from anything that can cause possible harm to them, And that includes not only vehicular accidents per se, but anything that can actually harm their physical well-being, And that's the importance po of having car seats, of installing mechanisms doon sa ating mga vehicles for us to be able to protect our kids, Walang magulang po na gusto mapahamak ang kanilang anak, And kailangan nating i-highlight yun sa kanila in terms of explaining to them why we need it, Of course, it's gonna entail a little cost, for them to be able to install mechanisms such as yung mga car seats natin. But sabi nga natin, a little prevention goes a long way talaga. not only in terms of preventing harm, but also keeping our families, our kids safe. So yun po talaga yung importance and yung highlight kung bakit natin kailangan i-explain yun sa mga magulang natin. Because we're doing it in the spirit of prevention po talaga and safety for our children.
Perfect. They are kids, the future of this country. But before we get any deeper into that, hopefully you'll enjoy probably our next segment and the doctor. So roll the video.
Right. So, thank you for that, Doc Dex, no? All right, yeah. I think he's here already. Go ahead, Doc Dex.
Next segment, hopefully, no? Let's play that video. Okay, it looks like we're having a little bit of technical difficulties, but what we would like to tell everyone is that we have a lot of things to share with you, no? So first and foremost, you can register now when you go to the Alaga Health app or Alaga Health Facebook page and even the website. You can access and see the different features that Alaga Health has to offer. So if you go now to the alagahealth.com website, no, this is what you will see there, no? So this is a preview of how you can access the Philippines' first digital health marketplace and health service hub. Yan. So kita-kita natin dyan, no? So from the Google Play Store, App Store, and of course, the app gallery. Yan. So all you have to do is click sign up here, right? And then this will transport you to another page wherein you can see how you can register as different groups. So you can register here as a patient, you can register here as a health provider, you can register here as a clinic admin, and then it will be very, very easy for you to do. You just click the preferred segment for you, and then you can register already your details and become part of the Alaga Health family. So you can sign up for the patient app, the partner app, or the admin app. All you have to do is click and then continue and then fill in your details. But that's not all, no? Because I also would like to encourage you to visit our friends at www.hellodoctor.ph. And since we're talking about kids today, let's talk about parenting. So Hello Doctor ay isa pong kapartner ng ang ating mga kaibigan, no, ng ating mga kaibigan dito sa Alaga Health, because we are serving everyone in every possible way. So Alaga Health is providing assistance when it comes to the services. Hello Doctor comes in when it comes to sharing that information, naman medically validated information. So you can view it here, no? So you can see a lot of the content that they provide. And for example, ito, maganda to. Pero usog and lawayan, what do these folk beliefs actually mean, and do they actually work in terms of medical adherence, no? Are they medically validated? So yeah, tingnan natin. So this one, actually, it's posted on the Hello Doctor website. Yan. What is pero usog o lawayan? Yan. And we check and tell everyone that there are practices that can match what is being advocated within the medical field and some that medyo hindi naman tugma. So, ang maganda po dito sa Hello Doctor ay medically validated yung information. And you can see here, no, if you look here sa may top right, no, this was written by Jan Alwin Batara. And all of the content po that is shared in Hello Doctor ay medically validated. So, ang ganda. If you want health services, Alaga Health. If you want health information, you have Hello Doctor for that. So, with that being said, really happy to share that with all of you. So now, I think it's a little past 9 o'clock na. Just ko, ang bilis. And I think maybe it's time for the wrap-up. Roll the video. Hey, wrap-up time, no? Since it's a little past 9 o'clock. So maybe let's get everyone's final words on how we can best take care of kids, probably even teenagers, adolescents, or any particular advocacy or even event that's related to child care or child safety na gusto po nating i-share sa ating mga viewers tonight. So, let's go down the line. I'd like to call on first, ito, for sure meron sasabihin tong si Ma'am because we are now advocating for the Bakuna Now campaign. Okay, so first up, Ma'am Girly Lorenzo. Go, Ma'am!
Yes, so for the parents, sana ma-vaccinate kayo, no? Huwag matakot sa vaccination kasi sana ma-reach natin ng herd immunity para makabalik na tayo sa ating normal na dating ginagawa. And for patient safety or for child safety, lahat po tayo ay may responsibilidad para sa safety ng ating mga anak. So dapat alamin natin ang ating responsibilidad tungkol doon. Thank you.
All right, thank you. That was from Girly Lorenzo of Kythe Foundation and of course, the Philippine Alliance of Patient Organizations. So, let's now jump to ito. Focal point talaga nung araw natin ngayon. Let's ask Ma'am Jofty, any thoughts lalong-lalo na when it comes to road safety and the big issue on car seats?
Ayan, sige. So, kami sa the Policy Center or Center for Policy Studies and Advocacy and Sustainable Development, we really support yung ating batas na yung RA 11229 or child safety in motor vehicles because ang pinaka napupuruhan sa road crashes, yung mga deaths nito ay yung mga our young generation or children by the age of 5 to 14 years old. Kasi itong mga 5 years old natin, ito na yung start ng kanilang pag-explore, ano? Kasi pumapasok na sila, so they look at the world as though it's their playground. So mahalaga na sila ay nababantayan at sila din mismo bilang mga bata ay talagang aware sila sa kanilang safety on the roads or habang naglalakad papunta sa school o kung saan mang lugar. So wag na nating dagdagan yung ating statistics na mga nababatay na mga bata because of a preventable condition or preventable such as road crashes, ano? In 2017, we have at least 3 child who die every day due to road crashes, ano, road traffic injuries. So, ang gusto natin, katulad nga na nasabi natin, marami na po tayong road safety laws that covers our children in public transportation. Wag nating isipin na ang pinoprotektahan lang po natin ay mga bata na sumasakay sa mga sasakyan or private vehicles. There are a lot of road safety laws already in place and it's a matter of enforcing them by our local enforcement agencies and the local government units. So dito sa child car seat, since it is new, I hope that our doctors here will help us advocate and really teach parents or encourage parents to use child car seats while transporting or while their children are with them on the roads. dahil po ito rin po ang mag-save sa kanila in case po na magkaroon ng road crash. So as I've said a while ago, putting them on your lap will not guarantee their safety because when it happens, kahit po kayong magulang na may hawak, matatapon po ninyo yung bata. So, may science naman pong pinanggalingan yung paggamit ng child car seats. Hindi po yan inisip lang or hinango lang sa ulap. There is a science to that and WHO is a very good source to check on the science of the use of child car seats. So, wag nating panghinayangan yung konting gagastusin natin para isave yung mga anak natin in terms of kung sakali magkaroon na road crash. So, laging prevention ang ating iisipin and harm reduction para sa ating mga kabataan. Maraming salamat.
Perfect. Thank you, Ma'am Jofty. No? Looks like car seat is it, no? And of course, nako, ito, very close to my heart. This is what we do in Popcom. Ma'am Mai, any final words and probably an invitation to watch ang ating Usap Tayo sa Family Planning. So, take it away.
Opo. So, marami pong salamat muli, Alaga Health, sa pag-imbita sa Komisyon sa Populasyon at Pagpapaunlad. So, kung nais nyo po ng family planning information at serbisyo, maaari po kayong mag-send ng message sa ating Facebook at Usap Tayo sa Family Planning at Official Popcom. At naway mag-join po kayo, sumali po kayo sa panonood ng Usap Tayo sa Family Planning with Doc GP ngayong June 30, 10:30 a.m. sa at Official Popcom. So, Doc Dex, lagi ka namang sumusuporta sa ating Usap Tayo sa Family Planning with Doc. Kaya iniimbitahan po namin ang inyong mga tagapanood na sumali rin po kayo kasi may mga contest din kami, namimigay kami ng load there at pag-uusapan natin ang balik probinsya kasama si Cabinet Secretary Cardo Nograles. Ayun, marami pong salamat muli. Kung meron kayong tanong at kailangan nyo ng serbisyo sa family planning, maaari kayong pumunta din sa Popcom Family Wellness Clinic sa Mandaluyong City. Libre po ang family planning kung gusto nyong kumuha ng mga pills, gusto nyo magpa-implant, magpa-vasectomy, magpa-ligate, at kung ano-ano pa, pumunta lang po kayo sa clinic natin. Pwede po kayong mag-send ng message sa Facebook at Official Popcom at Usap Tayo sa Family Planning. Salamat po, Doc Dex at ating mga magagandang kababaihan ngayong gabi.
Mga pala, no? Ako lang pala yung guy dito. Hello po sa inyong lahat. And of course, thank you for that, Mai, no? Panoorin po natin, Usap Tayo sa Family Planning official Facebook page po ng Popcom. And, of course, let's ask naman final words, Doc Via.
Alright. Good evening again, no, sa ating mga guests. At, of course, sa ating mga masugid na manonood ng Alaga Health Live. At if before natin makalimutan, no, isang maligayang araw ng kalayaan po sa ating lahat. At dahil araw ng kalayaan ngayon, palagi po nating isa puso ang sinabi ng ating mahal na bayani na si Dr. Jose Rizal, ang kabataan, ang pag-asa ng bayan. Kaya importante po na pangalagaan natin ang kalusugan ng ating kabataan. Kasi sila po ang magbibigay ng solusyon sa mga haharapin nating mga problema, sa susunod na kabanata ng ating generasyon, no? So, it is important for us to not only give emphasis to the health of our children, but also to their safety. No, we have to ensure that they're physically healthy, they're mentally, they feel safe emotionally, and that they have access to their basic needs, no, and their basic health concerns. And it's also important for our children to be empowered, no, for them to reach their full capacity po. Importante po na pangalagaan natin yung ating kabataan kasi sila po ang magdadala po ng magandang kinabukasan sa ating bansa. So, happy Independence Day po to everyone, and I hope you were able to learn a lot from our short segment. Ako, Doc Dex, kulang na naman yung time, no? Sana marami pa tayong magiging discussion on child safety and health, no, sa susunod na mga episodes ng Alaga Health. Maraming salamat po at magandang gabi po sa ating lahat.
Correct. Thank you for that, Doc. Be happy Independence Day nga po pala sa inyong lahat, no? So hopefully freedom from harm, freedom from dangers that can potentially affect our youth. Oh, ito, since we're talking about youth, let's get the final words of our dear resident pediatric consultant. Yan, Doc Annie Carpio. Any final words po or invitations to our parents and even young people watching this show?
Hello. So, emphasize natin ang prevention ay key. So, it involves proper education both from the families and also with the teachers and the doctors. Also, importante na maging up-to-date sa vaccines and then eat nutritious foods, exercise, and enough sleep. So, ito ay makakatulong para maging safe ang ating mga kabataan.
Alright. Thank you for that, Doc Annie. No? And of course, last but not the least, our wonderful and fabulous celebrity doctor and of course our resident psychiatrist here in Alaga Health Life, Doc Joan. Any final words po, Doc?
Yes, maraming salamat again, Dr. Dex and Dr. Via, for having me tonight. Ako po, as a mental health advocate, syempre ang ating topic kasi is on safety. So number one, ang ating mga tahanan po ay gawin natin isang safe space na kung saan ang mga parents po ay nakakapagbigay or continue to give the unconditional love, support, care para sa kanilang mga anak. Let it be a safe space para wag silang matakot to open up to us. Sa mga parents po, never compare, wag mag-compare po, no? Na itong anak ko ay ito, ganyan. Never compare, no comparisons between kids, between children, at in terms of safety also with regards to mental health sa mga magulang po or sa mga teachers sa school at sa lahat po, no, ng may mga interactions with the kids or youth. Make sure na they are always safe, meaning safety ang priority po sa lahat. Know the red flags, know the warning signs pag nagkakaroon po ng mga mental health concerns. No? So may mga red flags po yan or warning signs na kailangan aware po tayo lahat, especially because safety is a priority at ang any form po of threat to oneself or self-harm po, it's a public health issue at pwede po natin yan ma-prevent. So maraming salamat po.
All right, there you have it. Thank you very much, everyone. Look at the time. Actually, we went a little bit over time, but that's okay because I believe we all had fun. So, that actually ends our show. Kita-kita po tayo sa susunod na Sabado para sa isa na naman pong oras ng libreng konsultasyon at masayang usapan dito lamang po sa Alaga Health Live. Next week, nako, mga tatay, mga daddy naman po ang ating mga bida dahil ipagdiriwang po natin. Of course, kung nagkaroon po tayo ng Mother's Day special, magkakaroon din po tayo ng Father's Day special. So, muli ako po si Doc Dex Galban na nagpapaalalang alagaan ang kalusugan para umunlad ang ating bayan. At muli, ito po ang Alaga Health Live. Good evening, everyone!
Good evening!
Ingat po!